Plus, the other thing, when you're taking something like that, an exogenous hormone is still processed the same way in your body. So whether your body's making it or you're taking it, it's processed the same way. It has to do with how you're processing it. Hey there, welcome to the Female Health Solution podcast, where we discuss women's health, hormones, and everything else in between. Join me as we dive into the tools that you need to live your healthiest life. Today, we are talking about HRT. HRT, not something I typically talk about, and my overall disclaimer is when we talk about something like this, make sure you're working with somebody who is very familiar with HRT, who understands the full scope of it, and is willing to take your perspective into account. And just know that everybody is a bioindividual, okay? What works for some people doesn't work for everybody, right? So if you've tried something and you're like, oh, this was terrible, and someone else says, oh, it shouldn't have been. No, that was your experience. That is a real experience. And everybody's experience is different. And that's okay. That's okay. So I get this question a lot when people are wondering, should I do this? Is this something I need to do? Or can I work on my hormones naturally, right? I am of the mindset, right? And because, so if you're asking me, right, my overall opinion, and this is kind of a general blanket statement. So again, it doesn't work for everyone. You take your own health into account. I just want to give you information to help you make the next best step for you. So this is just one person's random opinion, okay? But I'm of the mindset that your body is designed to function the way that it should, to provide all of the natural hormones that you would need throughout your life on its own. And there are times that you may need to utilize different tools, whatever those may be, for a certain period of time to help your body function better. Now, does that mean that you would be on these things forever? No, right? Potentially not. But it depends on you, right? It depends on you. If you're like, well, I had this and this and this. Okay, well then that's not right. That's what I'm talking about. So take some of this into context of, I might not be talking about your specific case. I might not be referring to what you specifically went through. I know some women that have been through some horrific things health-wise, and using something like an HRT is the only thing that brought them relief. Great, right? That's specific for them, and that was the right thing for them. You need to make the right decision for you. I oftentimes come from it from a standpoint of, let's try everything natural first. Let's try to get your body functioning better first. And then if that doesn't get you the right result, then there's other options from there. Starting as conservative as possible, right? I think of it from the mindset of you slip and fall and you break and you hurt your ankle, right? Do you need surgery right away, right? Yes or no? Or should we try and bandage it, see what's wrong first, see if we can work with it naturally before just jumping to something extreme? You might be thinking, well, what if you broke your ankle? Okay, that's the extreme, not what we're typically talking about. If you sprain your ankle, which is what most people do, there's a lot of conservative things you can do to help with that ankle sprain, right? That's just an example to kind of keep into context here. So as I get into this conversation, I'm going to be coming at it from an Eastern medicine perspective. I feel like I have to do all these disclaimers even starting this conversation, because there are some people who will hear this message and say, oh, this is super helpful. Thank you. I was wondering what to do. And I was wondering if it was okay that I took my time with this, or if I, took a different path than the one thing that I've heard be recommended to me. If you're trying to go in and get assistance and you're saying, I'm exhausted, I'm having hot flashes, this and this and this, I feel like garbage. And they're like, and you're only being told to do this one thing. And you're like, are there other options? Can I try something else first? Right? Yes, you can. It's your body. It's your health. It's your decision. That's the biggest thing, right? And again, sometimes I hesitate to have these conversations publicly, because there are some people who say, well, this and this and this, and I tried everything. Okay, that's what I'm talking about then. If you did try everything, or if your case was really extreme, then that's something different, right? And again, I'm going to use my own personal story. This is what happened to me personally. And why I got into doing what I do, because I had ovarian cysts, PCOS ovarian cysts that burst and would put me on the floor. And it was exceedingly painful. It was horrific. And when I went in and try and get help, all I was told was to go on a birth control. That was the answer. And I was like, I don't want that because of all of these side effects, which you can Google. I'm going to read some things off for you guys today. Just straight up read it right off of my computer here. The reason I say this is because I went into these appointments and conversations saying, I do not want X, Y, or Z because of this, that, and the other. And then they were like, well, then we don't have any other options for you. Okay. See, that was the missing piece for me. I understand that your standard is when someone comes in with cysts or fibroids or this or any type of menstrual issue at all, that you go to a birth control. That is your, like, they don't have any other things to go to, right? There are no other chains of events or paths to go down when you're going into a Western medicine model system. And that's, again, I'm talking from personal experience here. So what I struggled with, I found a different solution. I worked with my body differently. I looked at how my body was creating, maintaining, processing those hormones. And that is where I found a lot of relief for myself. And that is what I talk about, teach, and everything else. So after spending the first several minutes covering disclaimers and saying, hey, if you don't agree, cool, right? The message I have is not for everybody. And if you're thinking, gosh, I already started on this, or I already did this, or is this too late? No, man, it's never too late. The body has an amazing ability to shift and change how it functions. You just have to give it the opportunity. But again, your case may be different. So take this with a grain of salt. If you're listening to like part of this message and you don't listen to the whole thing, please listen to the whole thing. Again, I only want this information to be helpful, to help you take a next step in the right direction for you. You are a bio-individual. What you have had occur in your life for your health is going to be different than other people. So you are on your own health journey, right? It's important to understand that other practitioners are trying to help you, but they can only help you as far as they have tools to help you. I use a lot of natural health solutions because I like to start on that conservative end. Does it work for 100% of people 100% of the time? Of course not. But it's amazing the things that I've seen shift and change for people, for women, when your body does function better. So let's dive in. Let's talk about the Eastern medicine side of it here. And again, I'm going to read off some of this stuff just so you can get context and understand. When we look at HRT and everything else from a standpoint of Eastern medicine, and some of this is going to sound weird. It's going to sound weird. I'm just saying that because a lot of times we aren't told different perspectives on the body. And again, if you're like, this sounds too out there, this sounds really crazy. Okay. All right. But again, if you're doing something that works for you, awesome. I'm just helping give some different information that can be helpful. So TCM is what people call traditional Chinese medicine. So I'm also licensed in this, as well as I'm a functional medicine practitioner, and I hold other degrees as well. Just putting that out there. Okay. In this traditional Chinese medicine background we're looking at here, the menopausal syndrome symptoms from this, right, is caused by a deficiency in kidney essence. That sounds out there if you've never heard this before. I understand. Keep in mind, also, the female body goes through a ton of different bodies in your lifetime. In my book, The Female Fat Solution, I have a whole section called The 7 Bodies of Eve. The 7 Bodies of Eve. And I've titled it that because your body goes through different bodies in your lifetime, right? It's very different between me and my husband. He has his sort of pre-puberty, post-puberty body, right? And I see it in my daughters as well. My daughters, and my kids. My son, pre-puberty, post-puberty, right? That growth coming from like a child to an adolescent to an adult. And girls, females, right? My daughters are going through like pre-puberty, post-puberty, all of these things, but there's going to be so many other bodies that you can go through in your lifetime. For example, I was the same. I had pre-puberty, post-puberty, right? And then I was an athlete. So how I treated my body, how I trained, how my body responded to things, that was very different. I went through pregnancies. So there was pre-pregnancy, during pregnancy, post-pregnancy, right? All of that. That was a whole different body I lived in. And then since then, the body that I've kind of returned to, and I have, been an athlete since then. I have done other endeavors, endured traumas and stress response and all that stuff, had to navigate that with the body I'm living in now. And now I'm in my early 40s. And a lot of times you're at this stage where a lot of women who are in their late 30s, early 40s, just in the back of your head thinking about, or maybe it's starting to creep up for you, that, am I in perimenopause? Is that coming up for me? For myself specifically, I am not worried about that. I know genetically, historically, all of that, it is a later game for that. For me, I know I've got at least, 8 years before I have to really start thinking about some of that. But I want to support my body hormonally for the next 8 years really, really, really well. But then creeping towards menopause. And then you have that perimenopause body, and then there's a postmenopause body. All of these different bodies that you live in, all of these different things where the core body function is different. It's just different. And I'm not going to say one is good or bad or anything. And I'm not talking about just the different body that you have throughout the month when you have an active cycle, just the different bodies you live in and what happens. And here's the thing is that you can transition from phase to phase to phase seamlessly with the right support for your system, right? Not everybody has the same thing. I'll use myself again as an example. Me and my sister, my younger sister, she's 3 years younger. We had 2 of our pregnancies at the same time. They were completely different experiences for us. She felt really good. She looked fantastic. She had very fast births. I'm not going to call them easy, right? But I mean, she had one babe where they told her the next time you have a baby, as soon as you feel a contraction, get to the hospital right away, because otherwise you're going to give birth at home or in the parking lot. Mine was not like that. I had emergency C-sections. I would bloat and retain water like no other. I broke out in hives all over my torso for months. It was like I had a completely different reaction and response than she did. What the heck, right? What the heck? Yeah, that was just, everybody is different. And the bodies that you go through as you go through these different phases of life can be different. So we have to learn how to shift, adjust, and adapt to it, which is unfair. I'm just going to say, okay? Because a lot of the time you're thinking, gosh, I've just gotten used to this. I've gotten in a good routine. I've gotten, good results with X, Y, or Z. And now it changes. And now I feel like garbage. Yes. But this is where understanding how to work with your body can be very, very helpful through these different phases. So the symptoms that come along with menopause, right? Not just going into menopause, because there are women that go into menopause and they're like, this was not a big deal for me. I don't know what y'all are talking about. I did great, right? And you're like, what? Yeah. But a kidney deficiency, kidney essence, right? This is different than the actual organ, your organ kidney, right? This is a meridian in the body. So the TCM treatments for menopause symptoms, they can include acupuncture, lifestyle changes like exercise, eating foods differently, and they emphasize restoring the kidney qi and reconstructing the yin-yang balance, as TCM posits that the yin-yang balance is disrupted during menopause. Yep. There's also studies that have shown using Chinese herbs and acupuncture can be as effective as hormone therapy in treating menopause-related symptoms. Again, menopause itself is not a disease or syndrome or whatever. Like, it is something that half of the population is going to go through in their life, right? If you are going to live to be a certain age, you will go through menopause. That is normal. That is normal. It's not bad. It's not negative. We just want to get through these different phases without getting our butts kicked, right? One study found that TCM combined with hormone therapy, they alter serum levels, blah, blah, blah. So again, a lot of these things are bioindividual. Many women are turning to TCM for the treatment of menopausal symptoms because the risks and side effects are very, very low, right? The risks and side effects are very low. So this is, again, starting with herbs, starting with lifestyle changes, all of those things as your first step. If you're like, ooh, I'm not feeling good. Ooh, is there a problem? It can be so effective and so helpful to start with some of these herbs and lifestyle changes. And because for so many women, they experience very positive outcomes from there. Awesome. If not, there's always other things that you can move to, right? But if you do the most severe thing first and that doesn't work for you, then what, right? So when we talk about some of the side effects of HRT and some of the, like, can it work for some people? It depends. It depends. And what I find is that, and this is just clinically from what I have seen from Dutch reports and working with women over the course of years, like specific women over the course of years, if they have a really tough time with their hormones before they even get into perimenopause, and then they go into perimenopause, menopause can be hard for them if they are not constantly helping their body maintain their hormone pathways. So stress, liver and gut pathways, all those things that help your body process hormones. If you're getting good, not good sleep, all of those things can impact how your body processes hormones. So when you have those hormones fluctuations, it's harder on your system. If you're doing a really great job maintaining your overall health and hormone pathways as you shift and transition into those different phases, it's much better. Again, I'm saying that from a clinical standpoint, from working with women from before they went into menopause to after and seeing multiple Dutch tests. So when we talk about HRT, the one thing, again, you can Google this stuff, you can look at it, but there's a lot of side effects that can happen. Short-term side effects, headaches, breast pain tenderness, unexpected vaginal bleeding or spotting, feeling sick, having nauseousness, mood changes, low mood or depression, leg cramps, rash or itching, because there's a reaction with histamine, depression, leg cramps. No, I already said that. Diarrhea, weight gain, skin irritations, bloating, PMS, lower tummy or abdominal pain, backache, acne, greasy skin, appetite and weight changes, change in libido, nervousness, anxiety, melasma, which is brownish or black spots on the skin, oftentimes the face, swelling, edema, and fluid retention in your hands, feet, and legs, and dry eyes, everything else. Now, you can have these symptoms onset within the first few weeks of taking it. It can take, sometimes people notice an onset and then their body kind of adjusts to it and it goes away. And sometimes it gets worse as time goes on and they're like, I can't do this anymore. I have to stop. Yeah. There's also things, I want to read these things off for you because I want to make sure that some of the most popular types of HRT, they have severe warnings and precautions. And all you would have to do is look up the insert. You can type in, like, the most popular HRT, the name that pops up, you type it in package insert, the name of it and package insert. And then it's from the FDA. The FDA package insert, like, there's 30 some pages of detailed information, and they have all of the things, the studies that they do, etc. And I went through one and I looked at this, and they were looking at studies and they did compare to a placebo, but they had a testing group of 70 women and a placebo group of like 40. That's not a very big sample size, in my opinion. Just saying. Yes. Again, for some people, this is very, very helpful to utilize for a short period of time. And for some people, it's not. Now, again, when it comes to the HRT, and if you're going to utilize something like this if you're looking at it as an option, again, I don't want you to feel bad. If you're like, I've done everything, I've tried everything, I am miserable. I have worked with my gut, I've worked with my hormones, I've changed my whole lifestyle, and I've been working at this for 2 years. I've gotten nowhere. and I just need some help. Yeah, right? Like, I don't want you to feel bad for having to utilize tools, but I want you to be fully aware of what you're stepping into. And if you get a recommendation, do your due diligence when you are on that extreme end, just because and again, if you have questions on this, let me know, but you can Google it and look it up on the internet, package insert, and it lists everything there. And just to be very, very informed for yourself. The other thing that I always like to mention and keep in mind, because as a natural health practitioner, I always like to keep in mind what we're doing now and what we're going to be looking at in the future. One of the things that I love about being a conservative practitioner is that, yes, I want to help you. If you're not feeling good, I want to be able to help you feel better as quick as possible. But I also want to help keep you there as long as possible. So I'm thinking long term. I'm thinking, not just now, but 6 months, a year, 5 years down the road, 10 years down the road. I have this conversation with women all the time. What are you doing now that's going to ensure that in 10 years you have great health? Yeah, because if you're going to do something more extreme, there should be a plan. And this is often the thing I ask women when they're like, yeah, this and this is what I was told. I'm like, okay, so, that's cool. That's cool. What's the plan with this? What's the plan with this? This was also my question, just so you know, when I talk about my own experiences. I'm sorry this is getting to be such a long podcast because I feel like I'm rambling now, but I want you to fully understand the scope of this. This is not an unreasonable thing to ask. When I had cysts and I went in and they were like, the doc told me, multiple doctors told me, birth control is your only solution. And I was like, I get so many negative side effects. Like, what else do you have? Well, besides telling me that I could just get pregnant again. And then I was like, okay, if I did take birth control, what's the plan? And they're like, what do you mean? Like, you would be on birth control. And I'm like, for how long? Because at this point in my life, I had been on birth control for about a decade previously. And then I had kids and was nursing for 6 years. And then I started getting cysts. Of course, my hormones were all wackadoo, right? So I was 32 and then had turned 33. So early 30s. And I had already been on birth control from the age of like 14 or 15 to 24. And now they're telling me I just need to be on birth control again. And I was like, no. What is the game plan here? What is the outcome? Like, I'm going to have to be on this forever till I'm like 70? What? That seems ridiculous to me. Plus, the other thing, when you're taking something like that, an exogenous hormone is still processed the same way in your body. So whether your body's making it or you're taking it, it's processed the same way. It has to do with how you're processing it. Yeah. So I wanted to understand why, or what was the game plan. And they were like, the game plan is that you're on it forever. And I was like, no, thank you. Was it harder to work through stuff and go through the process that I did and everything else? It took longer. That's for sure. I don't think it was harder because I didn't have to worry about any of the other negative side effects, right? It's one of those things that if you are looking at something like that, please make sure you're diving in, reading all of the information and asking all of the questions that you need to ask, and that you have a plan and outcome. And then the other question that I get a lot when we're talking about this is, well, what if I do this and then this and this, can I still work on my hormone pathways? Absolutely. For some people, it just takes longer. You know what I mean? Like, for some people, like, you really have to actively work on your hormone pathways while you're going through these phases of life changes, because the stress of having your hormones shift is hard on your body, and your body will revert back to slowing down those pathways. So we have to help keep them open. Yes. All right. That's what I got for you guys today. Sorry, this was a little bit longer, rambly, talking about this. 10 minutes of a disclaimer at the beginning, but I want to make sure that you understand, right? The true truth behind this, how we look at it from a natural perspective. We want to get your body functioning as well as it can first, and then make as many conservative changes as possible. If you were to need something else, okay. But how long, what's the plan, and that you are fully informed on what you're doing. So if you have any questions, please don't hesitate to reach out. This is a hard conversation for some people to have. But I want to make sure you're feeling informed and feeling good about whatever decision you make for your health moving forward. So that's what I got for you today. Thank you for being here and tuning in, and I will see you later. Thank you for joining me on today's episode. If you would like more information, just head on over to drbethwesty.com for all the show notes and information from today's episode. And if you're looking for more community, more support, you can find and follow me on Instagram, Facebook, YouTube, TikTok, and I would love to see you there.